Scene script. Why is the implementation of strategies and policies that promote health and well-being so crucial at the community level? Well, you see, health and well-being are fundamental to our quality of life. They influence how well we can function as individuals and as a community. It's not just about the absence of disease or infirmity, but also about the presence of physical, mental, and social well-being. At the community level, effective health and well-being strategies can create an environment that promotes good health for all. They allow for the identification and utilization of local resources and assets that support the health and well-being of the people within the community. This could mean anything from promoting local farmers' markets for healthy, fresh produce to advocating for the creation of safe, accessible spaces for physical activity. These strategies also enable the delivery of interventions that meet the unique needs of local communities. This includes considering cultural and faith-based factors which can have a significant impact on health behaviours and outcomes. For instance, dietary guidelines might need to be adapted to meet cultural or religious dietary restrictions. Furthermore, health and well-being strategies support communities by improving health outcomes and addressing health inequalities. By focusing on the social determinants of health, factors like income, education, and employment, these strategies can help to reduce health disparities and improve the overall health of the community. In addition, these strategies facilitate access to services delivered by a range of public and voluntary sector agencies in the community. They also promote services that are accessible digitally or online, ensuring that everyone, regardless of their physical location or mobility, can access vital health information and services. Finally, the application of the most recent evidence can improve the effectiveness of these strategies, policies, and interventions. By continuously learning and adapting, we can ensure that our health and well-being strategies remain relevant and effective. And to illustrate the impact such strategies can have, let's delve into a real-life case study. Meet Community X, a model example of effective health and well-being strategy implementation. Nestled in the heart of the country, this diverse locale is home to a vibrant tapestry of cultures, faiths, and age groups, each with their unique health needs and challenges. For years, Community X grappled with health disparities, from rising chronic disease rates to limited access to healthcare services. But rather than letting these hurdles define them, they chose to rise above, becoming a beacon of proactive health and well-being strategies. Through a collaborative, community-centric approach, they've identified local resources, delivered tailored interventions, and implemented policies that have significantly improved health outcomes. They've also facilitated access to a range of public, voluntary, and digital services while consistently applying the latest evidence-based practices to enhance their initiatives. Now, let's look at how this community tackled its health challenges through strategic action. Community X started by identifying and accessing local resources and assets to support their health and well-being. In this journey, Community X realized that the key to a healthier community lies within their own backyard. They began by creating a comprehensive map of local resources, a process that involved engaging with community members and drawing on their shared knowledge and experiences. This allowed them to identify local resources that were already at their disposal, including public parks, community centres, local farms, and health clinics. It wasn't just about identifying these resources, but also about understanding how they could be best utilised. For instance, the community centre, often underused, was turned into a hub for health and well-being activities. It started hosting yoga classes, nutrition workshops, and mental health support groups, becoming a beacon of health awareness. The local farms played an integral role too. By partnering with them, Community X was able to promote farm-to-table initiatives, encouraging healthier eating habits while supporting local businesses. Identifying and harnessing these resources was a crucial first step, but Community X didn't stop there. They also tapped into the power of public and voluntary sector agencies. These agencies provided a wealth of knowledge and support, offering services ranging from health screenings to mental health counselling. They played a key role in delivering interventions tailored to the community's needs. Moreover, in this digital age, Community X made sure to incorporate online resources into their strategy. They facilitated access to digital health services and online platforms where community members could find health information, join virtual fitness classes, or schedule telehealth appointments. This holistic approach to identifying and harnessing local resources was pivotal in supporting the health and well-being of Community X. It demonstrated that when a community comes together, aligns its efforts, and makes the most of what it has, significant strides can be made towards improved health. Through harnessing local resources, Community X took its first step towards improved community health. Next, Community X worked to deliver interventions that met the unique needs of its local communities. The key here was understanding that every community has its own set of characteristics, values, and beliefs. With this in mind, Community X took a deep dive into the cultural and faith-based factors that influence the health and well-being of its residents. They discovered that a significant portion of their population followed a faith that held fasting on certain days as a sacred practice. This practice was impacting the nutritional intake of these individuals. Community X, understanding the cultural sensitivity of this matter, didn't rush to implement a one-size-fits-all intervention. Instead, they worked closely with faith leaders and nutritionists to develop a health intervention. This intervention was designed to provide nutritional guidance that respected their faith traditions while also promoting better health outcomes. In another instance, Community X realized that a significant number of its elderly population was feeling isolated, leading to mental health issues. Recognizing that this group highly valued community gatherings, they coordinated with local organizations to host regular social events. These events were designed to be culturally appropriate and accessible, allowing these residents to connect with others and reduce feelings of isolation. These are but two examples of how Community X tailored its interventions, always keeping in mind the cultural and faith-based factors of its communities. The success of these interventions was not just in the positive health outcomes they produced, but also in the way they fostered trust and respect between Community X and its residents. By considering the unique needs of its communities, Community X was able to deliver interventions that were not only effective, but also respected and valued the cultural and faith-based identities of its residents. This approach showed that health and well-being strategies are not just about implementing policies, but also about understanding and respecting the people these policies are designed to serve. These tailored interventions were key to addressing Community X's specific health challenges. Alongside these interventions, Community X implemented strategies and policies to improve health outcomes and address health inequalities. In an effort to foster a healthier community, they adopted a proactive approach, setting up a dedicated health committee. The committee's task was to formulate strategies and policies that would not only promote health but also tackle the disparities that existed within the community. The first policy they enacted was a smoking cessation program. This was in response to the alarmingly high rate of smoking within the community, which had been identified as a significant contributor to health inequalities. The program consisted of awareness campaigns, cessation support groups, and free nicotine replacement therapy for those willing to quit. The impact was profound, with a noticeable reduction in smoking rates over a period of just 1 year. Community X also implemented a strategy to promote physical activity. They introduced a policy requiring all community events to incorporate some form of physical activity. This could range from a simple group walk to more elaborate sports tournaments. The response from the community was overwhelmingly positive, and there was a marked increase in the community's overall physical activity levels. In addition to these, the committee also focused on nutritional health. Introducing policies to promote healthy eating, they established a community garden where residents could grow their own fruits and vegetables. This not only provided access to fresh produce, but also created a sense of community ownership and engagement. Lastly, they implemented a policy to facilitate access to health services. They collaborated with public and voluntary sector agencies, setting up regular health clinics within the community. This made it easier for residents to access health services, particularly those who were elderly or had mobility issues. Through these strategies and policies, Community X made significant strides in promoting community health and well-being. Their approach demonstrates the power of community-led health initiatives and the importance of strategies and policies in creating healthier communities. Finally, Community X applied the most recent evidence to improve the effectiveness of their strategies, policies, and interventions. This is the crux of evidence-based approaches. It's about grounding all health and well-being initiatives in the latest, most reliable research. But how, you may ask, did Community X go about this? The answer lies in a meticulous yet rewarding process. They started by conducting a thorough review of the latest scientific literature. This helped them to gain a comprehensive understanding of the current state of knowledge in their particular area of focus. This review wasn't a one-time activity, rather it was an ongoing process, with the team constantly staying abreast of new research findings. Next, they carefully evaluated the relevance of this research to their community's unique needs. Here, they considered factors such as the demographic characteristics of their population, their specific health challenges, and their available resources. They then used this information to adapt the evidence to their local context. This ensured that their strategies and interventions were not only based on the best available evidence, but also tailored to their community's particular circumstances. Moreover, they didn't stop at merely applying the evidence. They also monitored and evaluated the outcomes of their initiatives. This allowed them to assess the effectiveness of their efforts and make necessary adjustments. In this way, they ensured that their strategies and interventions were not only evidence-based, but also results-oriented. It's also worth noting that Community X didn't work in isolation. They collaborated with other stakeholders, including public health agencies, academic institutions, and voluntary sector organisations. This facilitated the sharing of knowledge and resources, further enhancing the impact of their evidence-based initiatives. So what's the takeaway here? It's that evidence-based approaches are not just about using research to inform strategies and interventions. They're also about adapting this research to the local context, monitoring outcomes, and fostering collaboration. This multifaceted approach is what enabled Community X to make their health and well-being initiatives as effective as possible. With evidence-based approaches, Community X ensured their efforts were as effective as possible. So what can we learn from Community X's successful health and well-being initiatives? Our exploration of Community X's journey has given us a wealth of insight into the effectiveness of locally focused health and well-being strategies. One of the most salient takeaways from our study is the critical role that local resources and assets play in supporting the health and well-being of a community. Community X tapped into these resources, demonstrating how they can be leveraged to bolster health initiatives. We also saw the power of delivering interventions tailored to the unique needs of a community. By considering factors such as culture and faith, Community X ensured their interventions resonated with the people they were designed to help. This approach not only increased the acceptance of these interventions, but also their effectiveness. The case study further highlighted the importance of strategic policies in improving health outcomes and addressing health inequalities. Community X's success in this area underscores the potential of such strategies to bring about tangible change at the community level. Moreover, our journey through Community X's experience reaffirms the value of evidence-based approaches. By applying the most recent evidence to improve their strategies, policies, and interventions, Community X was able to significantly enhance the effectiveness of their health and well-being initiatives. The case study also stressed the importance of facilitating access to a range of services. Community X promoted services delivered by various public and voluntary sector agencies in the community, as well as those accessible digitally or online. In doing so, they ensured that everyone in the community could benefit from these services. In sum, Community X's story serves as a powerful reminder of the potential that lies within our communities. It's a reminder that with the right resources, tailored interventions, strategic policies, and evidence-based approaches, we can make significant strides in promoting health and well-being at the community level. Community X serves as a model for how communities can implement strategies and policies to promote health and well-being. In conclusion, implementing strategies and policies that promote health and well-being is essential for improving community health outcomes. Our journey today has taken us through the heart of community health and well-being, exploring the importance and practicality of strategies that foster and enhance the health of communities. We dove into a real-life case study which highlighted the power of collaboration in identifying local resources. By working hand in hand with local communities, we can unearth assets that can support health and well-being, from parks and community centres to local health services and digital platforms. Our case study also underscored the significance of delivering interventions tailored to the needs of local communities. We saw how taking into account cultural nuances, faith-based factors, and local traditions can make a world of difference in the acceptance and effectiveness of health interventions. We then delved into the crucial role of implementing strategies and policies that directly improve health outcomes and address health inequalities. Through our case study, we learnt that when communities are supported with effective strategies and policies, they are better equipped to overcome health challenges and improve the well-being of their members. Furthermore, we saw how facilitating access to services delivered by a range of public voluntary sector agencies and digital platforms can significantly enhance community health. It truly takes a village and a well-connected one at that to raise the health and well-being bar. We also touched upon the importance of applying the most recent evidence to improve the effectiveness of strategies, policies, and interventions. Our case study demonstrated how the application of evidence-based approaches can lead to better health outcomes and more efficient use of resources. So let's not forget, every step we take towards improving community health and well-being, no matter how small, is a step in the right direction. And with the right strategies, policies, and commitment to health and well-being, every community has the potential to transform into a healthier, happier place. Remember, every community has the potential to be a community X with the right strategies, policies, and commitment to health and well-being.